Hello, I'm Patrick O'Connor, co-founder of RunSmart Online. We're going to be talking about iliotibial band syndrome. Anytime you hear the word syndrome, the medical profession has a hard time, healthcare practitioners, describing what it is. I'm going to try to simplify that for you a little bit. The iliotibial band is a fibrous band that is located on the outside of the hip. Somebody's donated this hip for me, so we're going to talk about where it starts. It starts up at your hip and goes all the way to the outside of your knee, just to simplify that. This was a common injury in male men when they carried a bag years ago, and it created some friction on this big bone on the outside of this hip, this big tubercle. So they'd be leaning with the weight over their left shoulder, and it'd be rubbing along that hip. That would be iliotibial band syndrome at the hip. It can also happen down at the knee. And the reason for that is at the end of your knee, we have this Fred Flintstone femur bone, thigh bone, that has these two knuckles on it. And it would rub on the outside of that contour of that convex knuckle as well. So now imagine us as a runner running, maybe facing traffic, where maybe that hip is laterally thrown out to the side, and now with all the repetitions of the hip and the knee, we start getting some friction there. So how do we prevent this? Well, one of the prevention things that we look at is how do we strengthen those helpers around that. We can use foam rollers, we can do things to loosen the iliotibial band, but really it's a very hard fibrous band. It's not a muscle. Muscles respond better to the exercise than a fibrous band. So we're going to look to go up to the hip, and we're going to look at the quad and make sure that when we load that knee, that hip, we can absorb the collision with gravity better. Don't forget, running is balancing on one foot to balancing on the next. So when I stand and I load on that left hip, all my body weight, all my superincumbent body weight's off to the side. So here's my freight. If I can't hold that freight, off that hip goes, and I start rubbing that iliotibial band. Okay? If my knee goes in and back out, you're going to get a rubbing of that outside syndrome. Think of the knee. The knee doesn't go out, it goes in. So it doesn't absorb very well going laterally or off to the side. For more information on how to prevent iliotibial band syndrome, I would encourage you to continue to navigate through our site. Go to our 10-day free trial where you can find some of the exercises that will help you prevent iliotibial band syndrome and many other injuries that runners will incur.